Hello, everyone. I'm Dr. Sabapathy. I'm one of the infectious disease providers in Atlanta, Georgia, and currently in private practice. And I hope that this next 15 minutes or so would be a useful patient guide to monkeypox, which we are seeing in the news more often in the last week or two. Well, let's get started. The objective of this talk, now what I want patients and the public to know is learn what the illness is to become aware of the current outbreak, and to recognize monkeypox and its mimickers or imitators, know what to do for prevention and treatment, and then we'll finish off by kind of talking about next steps and the potential future. So what is monkeypox? This virus is what we call a zoonotic virus. So it's transmitted from an animal to humans. It's rare. We don't hear about it often, but it is caused by the monkeypox virus. That's where it gets its name. This family of kind of viruses, it's in the same as smallpox and cowpox. And as we talk about symptoms, one thing to know is that monkeypox is typically a milder form of smallpox. It's named after an outbreak in colonies of monkeys kept for research in 1958. So what they noted was that the monkeys started to have pox-like lesions, and hence the name came about. Normally where we find this virus is typically in Central and Western African countries. So if you were to look back, the past several decades, you'll see that cases have been ongoing in Africa, particularly in Cameroon, Dominican Republic of Congo, Liberia, Nigeria, etc., in those regions. And fatalities have been reported as well, but it's usually within the continent. There have been some cases related to international travel, but it's never been to this level. The natural reservoir is not known, it's not clear. So they think, and we think, that it's in non-human primates like monkeys and possibly rodents, and even prairie dogs have been reported, but nothing is clear in terms of where this virus is harbored and how it infects people. There's two strains of monkeypox, but the current strain that's causing the outbreak is West African. The other is Central African, or Congo Basin is the other name. And thankfully, the West African strain is the less severe one. So we typically don't see as high of a fatality rate, which is somewhere around 3.5% for this versus 10% for the other strain, for the Congo Basin. What is the current situation? So as of June 10th, 2022, there have been about close to 1,500 total confirmed cases among 33 countries, including the US. So why this is more notable is that majority of these countries typically do not report this. So this is not endemic to any of these. And that's why this is a big deal now. It's unclear why now. Why did the virus decide to spread like this at this time? And there's a lot of research going behind that currently, but it's not clear. The fact that what we know is based on the cases that have occurred so far. The majority is happening in the LGBT community, so particularly in male who have sex with male. So the MSM, but as in the gay community, among others, make up a high number of cases. But the thing to note here is that's not only limited to that. It's also seen in anyone with close contact with someone that's infected. So you don't have to be necessarily in that gay community, but you are still at risk if you're if you're near anyone infected. And we'll talk about ways that it's transmitted here soon. It's important to be vigilant about symptoms because, as we'll find out, the symptoms kind of indicate when you're contagious. The symptoms typically, anytime we talk about symptom of an illness, you'll hear incubation period. So what incubation period is the period of time that is between you getting infected and you getting symptoms. So with monkeypox, that's typically between 7 to 14 days. And once you're past that, then you start having these general symptoms. So these can be a fever, a headache, muscle pains, tiredness, just a general feeling of unwell. And you may also have swollen lymph nodes. And in fact, most likely you will have lymph node enlargement. So these lymph nodes can be in your neck, in your groin, under your arms. And the main thing to note why this is important is the lymph nodes is what separates these illness or symptoms from smallpox. So in smallpox, you may have all of these others, fever, headache, and then rash, but the lymph nodes are typically not there. They're not enlarged in smallpox. So then you may get the rash. The rash typically happens a few days after these other symptoms. And they start with, it's called centrifugal. That's how we describe the rash, but it typically starts on your face and then spreads to the rest of your body. It spreads to the other parts. And it has it goes through 5 phases. And I'll share some pictures here in the next slide, but it typically goes through all these 5 phases and completely falls off, forms a scab and falls off. And that's actually when you are not contagious. And from the beginning of the fever and headache to the full resolution of the rash is typically anywhere between 2 to 4 weeks. So the contagious period, like I said, is typically from the onset of the fever or headache or whatever your initial symptoms are. It's from that period until the scab falls off. So this is actually a good thing in one way, because compared to COVID, in monkeypox, you are contagious when you have symptoms. So you know when you may be potentially infecting someone. Whereas in COVID, you had a period of time before you developed symptoms, so you may have been transmitting the virus at that time. So this actually helps limit the spread of monkeypox. And it's deemed less contagious than COVID as well, because you don't need, you can, with COVID, you don't have to be as close to spread the virus. In monkeypox, you need to be quite close if you're at risk to spread it. So in these cases, when comparing the two, it seems to be less likely to spread quickly when looking at monkeypox. So the rash takes on different phases, like I mentioned. So these are some examples from the NHS, and this is also nicely portrayed in WHO and CDC's website. And the bottom right that you see with the full hand that they're showing, that's kind of the flat lesions that first start. And then these slowly form into these skin-colored, fleshy bumps. And that can become fluid-filled, that's clear, and then form pus in those bumps. And they eventually kind of form a crusty-looking lesion, and then form a scab and then fall off. So as you can see, there's a wide spectrum of the rash, and you may be kind of noticing the rash at any point during this time. So it's important to know kind of what all it can look like. But remember that in order for you to be deemed not contagious, this completely has to resolve and new healthy looking skin needs to appear. So how is this transmitted? How can you spread it? So we have found out that there's multiple modalities. One is coming into contact with infected animals. So this can be an animal bite, animal scratch, handling wild game, use of handling kind of animal products in general. And in addition, to animals, when you're looking at people, how do you, how it's, spread among people, that's typically through sores, scabs, the rash that I showed you. It can spread through any of those lesions, and body fluids. So that talking about saliva, and then respiratory droplets. So sneezing or coughing, so kissing, those are all ways to spread this. It's not clear if it can be spread through semen or vaginal fluid. So the cases that we were seeing in people that, like men who have sex with men and bisexual community, LGBT community, they likely spread the virus through contact with the lesions. They may have had genital lesions that then, you come into contact with directly, and that's how it was spread. It's not mentioned here, but I'll make a side note that mom to fetus transmission has also occurred, and that does play a role, especially for pregnant patients that are sick, which we'll talk about later. Prevention is very important. So avoiding contact with animals and people at risk is key. Recognizing the signs and isolating is important. And if you're infected, if you think you're infected, isolating yourself for the contagious period and making sure that you have the source covered, wear a surgical well-fitted mask. It doesn't have to be an N95, but like a well-fitted mask is important if you're around people and you think you're infected. Practicing good hand hygiene and safe sex practices as well. There are vaccines for what we call pre-exposure prophylaxis, so to prevent illness if you were to get exposed. But those are typically currently for laboratory personnel or certain healthcare providers that deemed high risk to contract the virus. So lab technicians especially, they're directly potentially can handle the virus in the laboratory. So they are recommended for them. And there's two currently available. One is actually the one that's FDA approved, but there's two options available. So what if you have been exposed or infected? And there are two vaccines. It's the same ones as the ones for prevention, but I'll kind of go into them here because it is, I think, more relevant for patients and the public to know this. And the two options are Jynneos, which is an attenuated live virus vaccine, and ACAM 2000, which is the live vaccinia virus. So what this is the live virus they used for the smallpox vaccine. And the first one, Jynneos, is actually the one that is FDA approved for monkeypox. The ACAM is really it's been only approved for the smallpox, but we're keeping it as an option because smallpox, there's a lot of similarities between the two viruses, so we feel that it will work. But Jynneos is generally preferred because it is likely to have less side effects. ACAM, if you think about it, ACAM is injecting live virus into your skin, and it'll form lesions and the rash will occur. And you basically are infected for a period of time, typically about 2 to 3 weeks, that you need to isolate yourself. And then, you develop immunity to the illness. So as you can imagine, there would be potentially more side effects and reactions to the ACAM vaccine. So Jynneos is really going to be the first line. You want to give the vaccine typically, it's 2 doses, but you want to give it within 4 days from exposure if possible. That's when you're going to get the biggest bang for your buck. Um, the four, within 4 days, likely it'll prevent you from getting sick at all. If you wait till, but you can get the vaccine anywhere between 4 to 14 days. So if you go towards more of the 14-day mark, the vaccine may reduce your symptoms, but it may not prevent the illness. So it just may reduce the severity. Treatment options. Most people, thankfully, have mild disease with no treatment needed. So they can handle this at home, drink fluids, take something for fever, and you get through it. But the prognosis is dependent on individual health. Given the fact that it hasn't widely circulated like this, so we don't have a lot of data, but we anticipate that the illness will be more severe in immunocompromised people like cancer patients, HIV patients, those on chronic steroids or any kind of immunosuppressants, pregnant patients. So it's really important to make sure you contact your doctor and keep them informed when, if you feel like you're sick and you've contracted the virus. There's no specific treatment approved. So I want to emphasize that there's nothing that have been officially FDA approved, but CDC has programs that provide antivirals, a lot of which were used in smallpox, that they think would provide benefit in monkeypox. So that includes tecovirimat, which is a pill, can be a pill or an injection, cidofovir, it's another antiviral, and the vaccinia immunoglobulin as well. So these are kind of all potential options if we feel like the patient is sick enough and they are immunosuppressed and have other risk factors. So I wanted to include a slide for pregnancy because I feel it's very important for, to relieve anxiety in this population when we're faced with this new disease. So in pregnant patients, there's been some recommendations that have come up. So the delivery route that's currently recommended, and this is pretty recent within the past week or so, is via C-section. Now, the highest risk for vaginal delivery is if you have lesions, if you're infected and you have lesions in the vaginal area, in the genital area. But the guidelines have kind of been, supporting C-sections across the board because there's relatively high risk with transmission to the fetus, to the baby from the mom. Potential complications can include stillbirth, miscarriages, and congenital monkeypox. The baby can get infected with it. So because of that, after delivery, you isolate the baby. They do the test on the baby to see, and if positive, often the baby can return to the mom. But if negative, we, observe the baby and the mom and make sure that they go through the course of the illness and make sure that they're safe to come back together again. The breastfeeding route. So it's definitely recommended to not breastfeed if you're infected, if the mom is infected. But if you want to, eventually continue breastfeeding, you can pump and dump until the baby is ready to directly breastfeed. And the vaccines available is the two that I mentioned before. The ACAM 2000 is contraindicated, so not recommended for pregnant patients. But there's no clear studies for Jynneos as most, even for a lot of other illnesses. There's just lack of studies for these vaccines in pregnancy. but there had not been any direct adverse effects that they have noted. So it's a conversation to have with your doctor, but I think it can be considered. What to do now? So what's next, and what to expect? I think the main thing is to, if you have any doubts or questions or suspicion, contact a health professional, contact your doctor or provider, and be cognizant of potential signs and symptoms of, um, of monkeypox. So self-isolate as needed. I forgot to mention earlier, but the rash that you were seeing, the pictures that you're seeing, other things that can mimic that are STDs. So, um, be mindful that if you feel like you have an STD, it's better to just go see the doctor and check. But like syphilis, um, herpes, and even non-STD illnesses like shingles can look similar to one or multiple of those lesions that I showed you. So definitely, ask for help or questions or concerns that you have. Wear a well-fitting mask if you think you have it or if you think you're infected. And make sure you avoid contact with animals as well because you can transmit, especially mammals, because we're looking at that mammals seem to be carrying and transmitting the virus mainly. So if you have pets at home, make sure you avoid contact. Lastly, it's important to stay calm and know that it's not projected at this time to be a pandemic. So I know people are in fear with COVID just, having simmered down a little, but the nature of this virus, the virulence, like how easy it spreads, all of that seems to be on a milder scale. And, with the proper knowledge and uh, the current measures that we're taking, we feel that we should be able to keep this contained. But know that there's a lot of uncertainty still. We don't know why this virus came up now. We don't know how efficacious the treatment or the vaccines will be, but there are a lot of research going underway for all of these things. Thank you for your time.